Emily mentioned, I'm Dr. Sather. I'm a psychologist in the Denver metro area. Been in the field, I think it's 35th year now this year. And I was asked by Carly to come and talk about my work and my career and what I do. So, no question's a dumb question. I like this to be interactive. Jump in, ask questions. If you're thinking it, someone else is thinking it. We'll do 30 minutes. The format is 30 minutes of me chatting, but you guys can jump in along the way, and then we'll have question and answer afterwards, okay? But you can ask questions along the way. Don't feel like you have to wait, okay? I like to be interrupted. So, right now, like Emily mentioned, I have 3 jobs that I'm doing. I have my private practice that I've had about 25 years. I do see a lot of law enforcement officers and their families. Since I do CIT training, does anybody know what that is? Have you heard of that before? Jenny knows, because she's an actor in their program. So, yeah, that's why she's sitting up there, and she has mono, so don't kiss her with that close. Yeah, no kissing. Well, she had kissing before, which we're not going to talk about, apparently. Okay, so anyway, I've been embarrassing her a little bit. So I have a private practice, and then I also do CIT training, which is Crisis Intervention Team Training for Law Enforcement, which came about in the 1980s back in Memphis. They had a police officer shoot a young 17-year-old boy who was developmentally disabled and wielding a knife. And the community was in an outrage because they ended up shooting him and killing him. And the Memphis Police Department said, we're going to get mental health training for our folks. And it has since then gone internationally. So personally, myself, I travel around the state and teach cops about how to deal with mentally ill people, de-escalating for patrol officers, SWAT investigators, hostage team negotiators, that kind of stuff. All right, so, and the other is supervising the probation officer, so done a variety of different things. But I haven't been in a classroom to teach, go back to psych times, since I taught at DU, and I stopped about 4 years ago. I taught in the graduate program for forensic psychology. It's a master's program at DU, so if any of you are interested in doing that. All right, so let's move along. No place for a girl. Why did I call it that? It's been dominated by men. When I was in college, which was 1978, when the earth was still cooling, I met with my academic advisor, and he said, what do you want to do? And I said, I want to be a psychologist. And he said, and do what? And I said, I want to work in a prison. He literally stood up and came over the table at me and said, that is no place for a girl. Yikes. You're all like, what? If that happened now, you get fired. You don't say that. He said, girls don't belong there. They will kill you. Okay? So then, of course, I said, perfect, that's what I want to do. But you're right. Most of the people I work with in the workplace, when I work in the jails, it's predominantly men. I think when I worked in Arapahoe County Jail for 17 years, there were about 5 females, 4 nurses, and myself. And the deputies took about 5 years before they realized I was a doctor, not a nurse, even though I would introduce myself. I'm Dr. Sather, I'm here to see inmate so-and-so. They'd get on the intercom. Joe Smith, come down to the red line, the nurse is here to see you. So, you can't have breasts and be a doctor, I guess. All right, so what's forensic psychology? Who knows? Anybody? Any of you want to be a forensic psychologist? Well, that's good. How many of you, absolutely, that's what I'm doing, no question? Okay, good. How many of you, no way in hell? I'd rather stick my head in the blender. Do you have any of those? Okay. All right, forensic just means the interface of the legal system and mental health. So it's the application of clinical specialties to the legal arena as defined by APA. So these are the kind of things forensic psychologists do. Threat assessment. Is this kid scary? Is he going to come to school and start shooting people? Is this a adult man in the workplace that's going to be going postal, as we call it? Child custody evals for court. All various types of psych evals, and I will talk about the ones that I do. Who knows what a competency evaluation is?
It's like if a person can, like, if they can like stand trial or
Yeah,
not?
very good. It's called CTP, competent to proceed. Meaning, if you are accused of a crime and you can't understand how the court system works or aid in your own defense with your legal counsel, we do not expect you to be in court, and we send you to the state hospital until you're competent enough mentally and medicated usually well enough to be able to proceed. So there are people that specialize just in that. Counseling offenders and victims is the most common probably, and most common for our master's level folks. There's a lot of work you do at the master's level and the doctoral level, but most of our master's level folks are doing individual treatment, group treatment, drug and alcohol treatment, working with offenders in a variety of different places. Death notifications, anybody want to do those? You go to someone's house and you say, I'm sorry to tell you your daughter's dead. Somebody's saying yes. Don't think you're weird. That was my favorite job I ever had in my life. As weird as that sounds. They're like, oh my God, are you weird? I worked in Denver Police Department in the Victim Assistance Unit as part of criminal investigations. So any death notification in the county, we had to go to someone's house, and we were the mental health team that went with the officers to provide support and explain, this is the coroner, this is a detective, this is what's happening in your house, this is what's going on. I liked it because if we didn't do it, law enforcement officers were doing it. Some towns, they do that over the phone. So I don't want people to hear the news that way. And I absolutely love that job. Screening and selecting law enforcement applicants. Has anybody ever heard of Nicoletti and Flater Associates in Denver? They are the mental health agency that screens people who apply to be cops. Would you be a good cop? They do all kinds of psych testing, they do interviewing, they do criminal background checks, but forensic psychologists are a main part of that. Assessing and treating PTSD, most of that is for our first responders. The majority of the cops I see have PTSD, no surprise. They are typically brought to me because they are on the street. They're either getting in trouble on the street, so yelling at people, not doing their job well, or command staff are worried about them because they seem depressed or anxious a lot, or they volunteer and say, I can't do this job one more minute. And they get sent to Nicoletti and Flater Associates, who does what's called an FFD, that's a fit for duty evaluation. And they do a psych eval and they determine, can this cop go back on the street right now or not? And if the answer is no, it's usually no, he needs some therapy in the meantime, and so then he gets referred to me. I do the therapy with them, then I send them back to Nicoletti for re-eval to go back to the street. So that's my job. What's the difference between fact witness and an expert witness? Anybody know? Because you'll do both as a psychologist. Okay, fact witness means you have some facts related to the case. So you're working with a patient who's claiming workers' comp, has some issues going on, and the court will say, I want you to come and tell us what he's been sharing with you, right? Or you're working with a family and they're going through divorce. What are the kids saying about the parents? Where do they want to live? You go because you have facts about the case. You're not an expert. If you're an expert witness, means you have special expertise in this area, and you're going to come talk to the court about eating disorders or about PTSD and how it affects someone's memory, because that's relevant to the case that's going on. But as a forensic psychologist, you do both of those. Jen? All right, so how we get there. Those of you that want to do this, why do you want to do it? Anybody? Are you watching CSI every night?
Criminal Minds.
Criminal Minds. And are you fascinated by it?
Yes. I find it extremely interesting and intriguing, and like I want to figure it out, and I don't feel like the average person would want to do it, and I feel like it needs to be done, so like I want to be that person, and I feel like I can like understand people, because I think people's backgrounds affects why they do certain things, and I don't think they should be dehumanized because they did something that could be classified as like they should be dehumanized, and I want to be able to like talk to them like a real person and find out like why they did it, and I find that like just super interesting.
You're going to make it. That's exactly why, right? We want to do it because we're fascinated by it. When I teach in the graduate school and I go around, what do you want to do for your career? Probably 90% of them say, I want to be a profiler in the FBI. How many profilers do we have in the FBI? about 6 to 8
Yeah.
at any given time. So if you want to play in the NFL, you could try that, or you could go, because that's about what's going to happen. But there's lots of things you can do if you want to work with criminals. That's what we do, right? So you will see lots of them. And the fact you said most people don't want to do it. When people ask me why I do it, I say because it's a job most people don't like, right? And because I'm fascinated by it.
People
So-
think I'm crazy when I say that, or like when I watch these shows, they're like, "Oh, are you a psychopath?" I'm like, "No, I want to figure out the psychopaths though."
Right, psychopaths don't want to figure out psychopaths, so the fact that you don't want to figure that out, really good. All right, so what you're talking about though is how we get there. Life challenges. Most of us that get in the field of psychology have whole kinds of crazy stuff happening in your life, and you're fascinated by it. You're like, why is my dad an alcoholic? Why is my mother doing that? Why did this happen to me? Why did that man molest me at camp? People want to know those things. That's what happens, right? You have to laugh or you're not learning. All right, so life challenges. That means something's happened to you that's been challenging, that you've overcome, and you're fascinated by it. So for example, myself, I grew up in a family of 10 children. I was the 9th of 10. I'm the only person that made it past the 8th grade. All my siblings were in jail, prison, on probation, or parole. My brothers were selling dope out of the back of the house, and I, at a very early age, learned if you want to stay away from parents' radar, behave. And so I did exactly what I should do, never got grounded, was straight A student, and off I went. And I thought, we're Catholic, how does conscience work? Do people have one? And I got very interested in psychopathy, studying psychopaths. So it's one of my areas of expertise to study psychopaths. On my 6th birthday, Richard Speck killed 8 nurses, South Suburban Hospital. Does anybody remember Richard Speck? Yeah, he went in the house. They were in like this dorm area. They were nurses. He went in to kill them one at a time. So he trapped them in the back bedroom and took them out one at a time, sexually assaulted them, and then killed them and left them in the bathtub, and then went and got another one, and went and got another one. This is when we did not have mass murders happening. This is 1966. It was my 6th birthday. I woke up the next morning. My sister actually had been hanging out in the area. There's a big park right there in Chicago next to it. That's where she and all her friends hung out. So I was fascinated by how does this happen. There was one female student who survived it. Richard forgot. He doesn't know how to count. I don't know what happened. But there was one girl that hid under the bed. The last 2 girls laughed. She said, I'm going to hide under the bed. The other girl said, you're crazy. He finds you under that bed, he's going to kill you. She said, we're getting killed anyway. I'm hiding under the bed. So she hid under the bed. He thought he was done when he came and got the last girl. She waited about 5 hours, went outside the next morning screaming off the rooftop, come help me, come help me. And there was a Chicago police officer driving home from work that heard her, and they went in and found all the bodies. So that's, I got, what is that about? Is that bad parenting? Like, how bad a parent could you be where people are stabbing each other and sticking them in the bathtub? So that's how I got there. All right, how many of you want to go on for your doctorate? Yay, good, good, good. Can you work in the field without it? Of course you can. You'll just work doing different things. So you want to decide, do I want my master's or my doctorate? If you get a doctorate, do you want a PhD or a PsyD? If you want to do more research and training and academic stuff, you're going to be over here. If you're going to do more clinical stuff, consultation, supervision, and training, you can do training in both. PsyDs can also teach too, but they generally don't spend time doing a lot of research. Some of them do, but not usually. But you can teach in PsyD programs. So I teach in the PsyD program at DU. I did for a number of years. Do you have to be in forensic psychology? No. You can be in clinical psychology. When I went to the PsyD program at DU in the early 90s, they did not have a forensic program. They didn't get it till 2000. So at that time, my major was clinical psychology and my doctorate, and we had what's called a specialty core, and my specialty core was forensics. So a lot of my internships were in the hospitals and jails, those kind of things. All right. So where are you going to work? How many of you want to work in the courtroom? Anybody? Okay. So you'll be doing that. Probation, parole, detentions, jail, or prison. You can work in police departments. A lot of the police departments now are having master's level mental health people ride with the officers in the community. So when they have people in a mental health crisis, they have someone there to help. So I know a number of gals that do that, they absolutely love it. Community. Do you want to work in a private workplace? You can. You could be doing contractual work, doing evals for threat assessments in places. Do you want to go into people's homes, like if you do death notifications or crisis on scene or on the street? And then private practice. So a lot of times you're doing a lot of this work like I do. I work out of my private practice as a consultant, and so people hire me to do a specific training or specific gig, and then I bill out, and I have a number of departments I work for. I just spent, 2 weeks ago, I spent a week in Aspen Police Department for their wellness week. They're finally figuring out, ooh, maybe we need to do that for our officers. So I had 3 days there, taught vicarious trauma, dealing with trauma when you're in the workplace, for the officers, and then I had a separate class for spouses and children, which was interesting. What does it feel like? My dad's a cop. What does that mean? And then I had 19 individual appointments, which was more than I anticipated was going to work, and just drop-ins. So people come in for 50 minutes. This is my job, this is what I'm doing. I saw a kid beheaded. One of the gals I saw had seen a baby beheaded the night before. Okay, next. So here's all the things you're doing. Researching, being a professor, being an evaluator, a bunch of different stuff, therapist, advocate, trainer, and supervisor. This is what I'm doing. Everyone told me when I got my bachelor's degree, if you don't go on for your master's right now, you never will. That's not true. If you don't come back to it, you don't belong in it. You will come back. I did my bachelor's, then I went to Keystone and said I'll be a ski bum and joined a ski team. And about 2 years into that, I went, this is really stupid. This is not what I want to do. Because everyone's acting like they're 15 and I'm kind of over it. So I went back, I got my bachelor's at Illinois State, then I went back to Illinois, got my master's, 2-year program. And then everyone said, you have to go get your doctorate. And I'm like, oh my God, I don't want to read anything more complicated than the newspaper for the next 10 years, because it was really hard. I was a full-time master's student and working full-time. It was a little insane. And then in '93, 4 years later, I went to DU to get my doctorate. All right, so where have I been working? Battered Women's Shelter, the very first job I had, oh my God, with my bachelor's degree, I ran the shelter, 1985. Rural Illinois. HIV had just come out. None of the officers would go in a house if someone had HIV. Everyone thought it was like the bubonic plague or something. Very rural, very conservative. I wanted to train the police officers on how to deal with battered women, how to bring them to our house. Just bring them. You don't have to talk to them. Just bring them. So I met with the chief and he said, kid you not, those women like what's happening to them. Have a nice day. 2 sentences, that was it. That was law enforcement in 1985. Yes, not so rough, right? So, how do you get cops to engage with you? You bring food, and you drink. That's what happens. What ended up happening is I went on a ride-along. I started dating the officer that I was on a ride-along with. There's the tricks of the trade. So, started going out with them for happy hour. They called it choir practice. Choir practice is cops drinking after work, like from midnight to 2 a.m. So we drank a lot, and they said, yeah, you're not so weird as a mental health person. I said, not so bad. So I learned a lot in that process, and then started doing lots of training for them. And they started bringing women in droves. It was really great. I worked in the schools, Denver Public Schools, the worst of the worst, elementary schools, the state hospital. We have 2 of them, Colorado Mental Health Institute. One's in Fort Logan in Denver area. That's where I did my doc internship. And then down in Pueblo, which is where we send inmates when they're incompetent to proceed, or they are so out of control that they can't function in the jail environment. HMO, I worked in a research program, University of Rochester, as a therapist. So you can be a therapist in a research program, studying the impact of mom's depression on her attachment relationship to her toddler, which was fascinating. We followed those kids for 15 years. I was only there 2 years. I worked at Kaiser in the child and adolescent unit. I worked in halfway houses, doing groups with offenders, moving from prison to the community. So I had a substance abuse group. I had what we call cognitive group, or the offenders called cognitive thinking group, just redundant. Cognitive group was for, we called them our tidy whiteys. They were usually middle-aged white guys that had committed white-collar crime. And then I had a group called criminal culture, which is my absolute favorite. So it was gang members taking all their skills of being gangbangers into being productive in society, which was fascinating. So we did a lot of language stuff. How do you engage with gang members? I was usually the only white person in the room. I'm tall, I'm blonde. Female, and the only female in the room was all men. Yeah, it was great. We had a fabulous time. I was from Chicago, so it gave me some cred a little bit. But we would do language. They said, teach us a tidy whitey word. So I would teach them a word. I go, what's insolent? The guy goes, I know, my sister takes insolent. I'm like, that's insolent. Are you trying to make fun of us? No, I'm just saying that's not it. And I would say, okay, all right, what's crunk juice? What's crunk juice? Does anybody know what that is? It sounds like a drug, doesn't it? It's Kool-Aid without much water. They have Kool-Aid with sugar, and then they put water in it just so it makes it wet, and then drink it. Yeah, they would tease me. You white people, you can see right through it. I'm like, what? Corn juice? Or I got a bitch in my jacket. What's that? First day I was in group. Guys were like, how'd you do in your parole hearing? The other guy's like, oh yeah, I was a fucked up man. This guy got a bitch in my jacket. And everyone's like, oh, jeez. This is going to be a long night. What is a bitch in your jacket? Okay, your jacket is your file. It's your criminal file that goes with you to parole hearings, to supervision meetings. What's a bitch, other than what we know? Anybody know? In Colorado, if you commit a serious crime 3 times, you are called habitual offender. Is that what you're going to say?
I was going to say like a mark on your record or something.
No, it means you're called, we call it the bitch and the super bitch, which means if you keep doing the same crime over and over, instead of having 10 years in prison, you'll get 30. You have multipliers. And people don't know it, or they don't think they got caught. This is your 3rd bank robbery. We call it, you are now labeled a habitual offender. And so your getting off easily is now going out the window. So they call them bitches in their jacket. Okay. I love it. We had so much fun. All right, so jails. I worked in Arapahoe County Jail 17 years, Douglas County Jail for 3 years, Broomfield Jail for 3 years. Absolutely loved it. Anybody want to work in a jail or a prison? No place for a girl. I just good for you. Why do you want to do that?
The psychopath type thing, I'm so curious and so interested in that. I just want to talk to them like Ted Bundy.
Well, you see psychopaths in jail.
Yeah, a lot of them.
When you think of the jail population, about 3/4 of the inmates in the jail population and prison population meet the criteria for antisocial personality disorder. What does that mean? Doesn't mean they're shy. Cops always go, oh, they're shy. I'm not going to the party, I'm antisocial. No, that means you're a criminal. So you could be a shy criminal, but antisocial is meaning against violating the rules over and over again.
I was going to say violating social norms.
Violating social norms is antisocial.
Social norms.
Right.
Sorry.
Within that 3/4 of the piece of pie that you have antisocials, then you have 1/3 of those meet the criteria for psychopath. Okay? So one of the jobs I had when I worked in the halfway house was determining when someone came out of prison, they're now in the halfway house, they're doing their parole time, how much treatment should we give them? Is this a high-risk guy? Is he going to reoffend? We know if he's a psychopath, his chance of reoffending is multiplied exponentially compared to his peers. And so I would conduct what's called the Hare Psychopathy Checklist. Has anyone ever heard of that? Okay, it's from Robert Hare out of British Columbia. He's our guru in psychopath assessment. So I was trained by him, was in the halfway house, and so I would have offenders coming in, and I was trying to determine, are you a regular criminal, low-key guy? Are you Ted Bundy category? Okay. And I had a lot of Ted Bundy categories. How these people got let out of prison, I don't know. I had one guy who had stolen 8 vehicles before he got caught. And he was stealing like Mercedes, Maseratis. How do you steal those cars? Gorgeous guy, built, African-American, late 20s, beautiful. He walked in the room, I went, whoa. Well, go ahead and have a seat. Now, how is he stealing cars? He was pretending he was a Denver Bronco. So he would go to the car dealerships and say, he would find a young, attractive female who would have the reaction I had, which is wrong. So he would go up to her and say, I don't want anyone to know I'm here. We have a game in Buffalo on Sunday, and we're leaving tomorrow. And I don't like all the media attention. So it'd be okay if you just let me drive a car by myself, and then I'll bring it right back. Yes, 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 over. So when I meet with him, he sits down. I'm like, oh my God. He goes, so he's telling me the story. I said, my understanding from the PC, which is the probable cause for arrest, the paperwork I get from the police. My understanding is that you were impersonating a Denver Bronco. He said, I never said I was a Denver Bronco. I said, well, here's what you would do. He goes, I play soccer in Buffalo with my friends. I never said it was a Broncos game. I'm like, so what's with the media? He's like, I'm very good looking. I don't like media attention. I'm like, well, you're gonna get lots of attention, because guess what? You do lots of bad stuff. And when you do bad stuff, people descend on you. So in psychopaths, we're measuring 2 different factors. We're looking at what we call factor 1, which is our superficial charm, their ability to charm the pants off anybody, glib, they can talk a great story and convince people. It's also called the parasitic lifestyle. These are people that live off of, they find women and live off their money. I had one guy who had bought 7 women, different women, houses with his drug money, his drug earnings. And he said, I'm married to all of them. What? How is that happening? He goes, oh yeah, and they all know each other. They hang out and shop together. I'm like, oh shit, no, they don't. And sure enough, I call the parole officer. She's like, oh, I've met them all. They come in together as a group. So he was buying them houses and sleeping with whoever he wanted to do and do whatever he wanted to do. Okay?
So, I just have a question. Just like these psychopaths, like they're very good at like superficial charm and finding their way through a social situation to basically go unnoticed. Do we have like ways as like mental health professionals to like see through that at all? Because like
yes, you do, and your best tool is you. What we know from research is men that interview psychopaths feel sick to their stomach. It's usually visceral, like cops will feel, like detectives feel like I want to throw up. For women, it's their skin, which is really interesting. Women feel like they have to take a shower after they meet with them. It feels like you've been slimed. And one of the ways you know is through blinking. Simple thing. How often does the average human blink? How frequently? Every 3 to 5 seconds. Psychopaths, how often do they blink? About 13 to 15. That's what gives you the willies. So when I interview an inmate and there's some question about, psychopath, I had one guy who killed 3 prostitutes actually, and I said, I want to see him walking towards me. And the deputies always get mad, go, Doc, you got to be behind the red line. I'm like, I know, I want to see his face. So what he does, if they're coming, because they want to control the interview, is this. Are you dying? Doesn't it feel like you have to take a shower? And then when they sit down, they do real slow. And then they don't break eye contact, and you're like, what is that? So luckily, many of them are not bright enough to really trick you, but I've had some really, really good ones. If they've been in and out of prison several times, They know how to do it.
Part of like why I was wondering about that is I can't remember where I've seen this. I thought I've seen a statistic that a lot of psychopaths have actually been in therapy to like
They get
learn
worse.
how therapists.
It's what, yes, and it's one of the things you don't want to happen is to put him in therapy, and you will, because you will have the justice system going, oh my God, he killed 3 people. He has to be in treatment 3 times a week, and I'm saying he's a psychopath. If I do the eval and he's a psychopath, we don't want him in treatment, because all he's doing is learning how to manipulate people, right? Yeah, but try to get probation officers and parole officers to understand that. It's a lot of educating around, the scarier he is, the less treatment I'm gonna do, right?
So it's about
Because
trying
they're
to
very manipulative.
not
Yeah.
just armed with abilities to go unnoticed.
Yeah, yeah. If you do it for long enough, I mean, I'm at the point where, like, if they enter the room, I can already, it feels squirmy. I can feel it. I had one guy that was 64 by the time he got to the halfway house. And he had been in prison all but 5 months of his life, some kind of custody, since age 10. When he was 10, he was, or 9 actually, when he was 9, he was stealing from hardware stores. And then he would steal all kinds of tools and then sell them with his buddies. He's 10. Who's buying tools from a 10-year-old? They were. This is back like in the 50s and 60s. But he had gotten in this justice system, then he was in, then he was out for 5 months in his 20s and 30s, and what he had done was killed 2 police officers, and also killed a guy who he thought had money in his house. How does he find that out? He's out eating lunch, he overhears construction workers at the next table saying, our boss is an idiot. Did you hear his wife talking? He keeps all the money from the company in the safe at home. We've told him that's not safe. So what's this guy doing? He's listening. He's back in the days of phone books. He goes to the phone book because he hears the guy's name, he finds his address, goes to his house, the guy opens the door, he shoots him in the face because he wants the money, right? So he shoots him in the face. Is there any money in the safe? No, because the night before, the wife had convinced him to put the money in the bank. So there was no money in the house, but he killed that guy. And then killed 2 police officers who were chasing him afterward.
So psychopaths, are they not always like super smart? Is it like, so what does it mean really to be a psychopath? Because sometimes with your examples, I'm getting the impression that they know how to like manipulate people so they don't have to do these things, and other times I'm getting the impression that they don't really have that like on and off switch in their brain telling them, hey, this probably isn't gonna work out.
Right, it's called like snaky smart. So they're not book smart typically, but among our psychopaths, they have the average curve, the same normal curve as you and I do in the normal population. So you have really smart ones. Most of them hopefully are in prison and we don't let them out. And then you have really dumb ones. You get some dumb ones and they get caught pretty quickly, right? But you can have people, general average IQ, that are psychopaths. Yeah, good question.
So I know with some psychopaths, they just end up being kind of high functioning and being like really good at business and like CEOs or whatever. If you had a client that you determined was a psychopath, how would you figure out if they were really like a threat to society or not?
Okay, really good question. So we have, on the psychopath checklist, we have 2 factors. We're measuring on the superficial glib charm, and I didn't get to the second factor, is criminal history. So you will have some guys that haven't gotten caught, right? So there's a book called Snakes in Suits, if you're interested in white-collar crime psychopaths, the Enron people, right? So these people lived a normal, law-abiding life, but got really good at manipulating people and stole all of their money. So they would, what we call load, they load heavy on factor 1. There's 20 factors on the first one, 10 factors on the first one, and 10 factors on the second one. In each of those items, I'm interviewing you and reviewing charts, and I'm checking, are you a 0, 1, or 2 on this item? So glibness or superficial charm, a guy who's really charming, like the guy who was stealing the cars, he got a 2. Then you have other guys that aren't that charming, like maybe 0 or 1. Then you add up, the closer you get to 40, 40 is the highest score you can have, and then we're looking at, So I'll give you an example of a guy that didn't get flagged initially. He was dating a woman. I'm trying to remember, they were married eventually. They had met in college, they were dating, they got married, they had a baby. Wife was a nurse, he was some business salesman. And she comes home one night after her swing shift at midnight, baby's crying uncontrollably. The baby's like 14 months old, very listless, just screaming bloody murder. So the nurse, she's trying to do medical stuff. She goes, oh my God, she got an earache, what are we doing? Took the daughter to the emergency room, and they did x-rays, and she had 37 broken bones. So what had happened was, the husband, while the wife's at work, gets frustrated with the kid who won't stop crying, and starts shaking the baby, then beating the baby. So by the time the wife gets home, the baby's in the crib, right? So he goes to prison, 3 years. He gets out, the kid's now like 4 and a half, and he's demanding that he has unsupervised visitation with the 4-year-old. And the mother's like, yeah, no. So he said, I'll take you to court. So they went to court. I got involved because the master's level therapist that was doing the initial intake with this guy in the mental health center had been in my class. She was one of my DU students. I had taught about psychopathy, and she called me and said, this guy gives me the willies. Can you do an eval? So I did an eval of him, very charming, very attractive. He looked like Scott Peterson. Remember Scott Peterson who killed his wife? So I come out to the waiting room to get him in my office, and he's holding 2 glasses of water. I opened the door, I said, I'm Dr. Sather, and he goes, I'll set these down for you, doctor. I thought you might be thirsty. Where does he get the water? Out of our staff lounge. He went, so I have a private practice, there's 3 of us that share the waiting area, and there's a water dispenser with plastic cups for, the patients. He goes in the back, gets into the cabinets, takes the glasses out, starts pouring water, and thought, you might be a little more comfortable. 3-piece suit, dressed to the nines. Oh my God. I don't even have to finish the event. Why are you bringing me water? But very charming. I was on Prozac. When you're depressed and you get upset and a baby, but I didn't do anything wrong. In the meantime, his ex-wife, the mother of the girl, is calling me. Please call me, I have to tell you stuff. And so I called her, and she said when we were in college, he had 3 DUIs, that he talked the police officers out of arresting him, because he was so charming, even when he was drunk. And she was crying, and she said, I can't tell you anymore, but my best friend that I was in the sorority with at school wants to talk to you. So I said, okay. So I called her best friend to do the eval. And her best friend said, are you ready to be creeped out? I said, sure. What do I do for a living? She said, I was dating his best friend. So let's say Mary's the mother of the girl. So Mary and Susie are best friends. They're dating 2 guys that are best friends. The 2 guys live in an apartment. And she said, one night, my best friend was gone with him. And I told her all the time, that guy's creepy. Don't marry him. There's something weird about him. They were out. I went to the bathroom. My boyfriend fell asleep. And I went in that guy's room. I'm like, oh, God. She said, I pulled the desk drawer out. And hidden in the back were little white pieces of index, like an index card, with girls' names on them with lockets of hair. I said, thank you very much. The information is very helpful to my evaluation, right? But this guy was very charming. No one knew, and he was saying, I don't have any criminal history, a very prominent job, I didn't do anything wrong. Why? So any of the people in the room do not collect locks of hair with names on them in your drawer. Because we call that what as a psychopath? Anybody know? Trophy behavior. Yeah. You were going to ask another question.
Yeah, so are they aware of how they're acting? Or is it kind of I'm doing this and they're not oh, because sometimes you do things and you're okay, this is just how I am, but then sometimes you're doing things on purpose to impress people. Are they aware?
They're doing things to deceive people, which is a little different than impressing. They think they're great enough that even if they don't try, they will impress you. Because they're so special, you will love them, right? But they're purposefully figuring out a way is, I want something from you, and how can I get it without you knowing it? We call it duping delight. Okay.
I've heard this, but I'm not sure if it's true. Does it tend to pair with narcissists?
Yes. Narcissistic personality disorder. Yeah. If we add psychopaths are called a special kind of narcissism, which is called aggressive narcissism. So narcissism is I feel fabulous, I'm special, you're not. Aggressive narcissism is I'm special, you're not, and I'm going to get something from you because you owe me something. And I'm going to trick you until I get it. So I like it because it's like detective work, so you're figuring out what they're doing. So the guy that had killed 2 police officers and came to me, he was telling me about the time he had robbed a bank. Psychopaths have a variety, we call it criminal versatility, lots of different types of crime. So he had robbed a bank in the getaway car driving, this is in the mid-60s, the police are chasing him, he dumps the car, there's a woman hanging laundry on the clothesline outside in her yard, and he goes up to her and says, "You're gonna give me your car." And she said, "No, I'm not," and he pulled a gun out and said, "Yes, you are." So he's telling me the story, he said, "I brought her in the kitchen and I tied her up with the phone cord." This is when we had landlines and you had phone cord. And he said, "I'm so happy I didn't hurt her." What? He goes, "When I was in court a couple weeks later, her husband was there, and he was really big, so I was so glad I didn't hurt her." I'm like, okay, so you held her at gunpoint, you wrapped a cord around her legs, left her there to die, but you didn't hurt her. And he goes, "Well, after I was done, I pulled her dress skirt down over her knees. I'm not one of those guys." Woohoo! She was so glad she met you. Now, he went to prison, life in prison without the possibility of parole for killing 2 police officers. Why am I seeing him in a halfway house? Did he get out of prison? How do you charm your way out of prison? Psychopaths have perfect behavior in prison under the cameras. They will be able to tell you, they're called hot spots. Where's the spot in prison where the camera does not see you? And they'll beat the living daylights out of people and kill them in prison. But they know how to not get caught. So he decided he was going to go work for the psychologist in the prison as his assistant. Psychologist was dumb enough to be convinced by him. And so he went to be the assistant. So the first night I meet him, he comes in and he says, "Do you know Dr. So-and-so, blah, 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 from down in Canyon City, where the federal prison, or the state maximum prison is?" And I said, "No, I don't." He goes, "Oh, well, everyone knows him. I used to be a psychologist, so I don't know if you knew that." Psychologist, he would hand out the OpScan sheets, the answer sheets for the group personality test for inmates. But he presented himself as a psychologist. And he decided while he was there to get a pen pal in prison. He got on the pen pal system. Who's his pen pal? A parole board member. She comes to see him, he charms her, they get married.
No.
She activates a campaign to get him out of prison. They are now married in the community, yeah. Now, while I'm interviewing him, this is Ted Bundy. While I'm interviewing him, all I'm thinking is, "Oh, I wish I had a video of this for my class at DU, it's perfect." So I said to him, I go, "Would you be okay with me videotaping our sessions?" I said, "We're gonna have to get like a zillion people to sign off on the paperwork because he's so high profile, but I want to be able to do that." Now, your therapist says, "Can I videotape our sessions?" What do you say? No. Why not?
It's private.
It's private. If you're a narcissistic psychopath?
No, yeah,
Right? He's like, you either say no or you ask a question. What's the question you ask? Why? Never ask me why. Because when I asked him, I'm like, oh God, how do I answer it? Because I teach psychopathy and you're perfect. I mean, what would I say? So he says, "I have a better idea, doctor. I think I should come to your class with you. And I could teach all those young therapists how to keep those youngins out of a criminal lifestyle. Because you were so good at it. You're 64 and been free 5 months of your life." So I said, no, we're not going to do that, but I'll talk to your case manager about doing videotaping, because I was so thrilled. I still have the videotape of him. So I talked to the case manager the next day. We had a halfway house in the basement. I was in the mental health center up here. And luckily we're friends. And she said, "What did you tell him yesterday?" And I said, "Why?" And she said, "Well, he came to our case management meeting in my office last night. And he said, Dr. Sather and I will be traveling the lecture circuit across the country. And I think you have to sign some papers or something. So just so you know they're coming. But when I'm not here, you'll know where I am." Let's go to New York with a psychopath and teach class. What are you talking about? She said I could not keep from laughing, right? So they were saying, get him in treatment, he needs him in treatment, he needs him in treatment. I said, I did not want him in treatment. So we compromised and I saw him once a week for about a year and a half. Doesn't they get better? No. We're just containing them, basically, right? All right, so those are all, here's the things I do, train in child and adolescent. How many of you want to be a kiddo person? Okay. You can do child, adolescent, and forensic. I do child and adolescent, that's not forensic too. You need to get out of this, don't do this all the time, because your head's gonna scroll sideways, right? So I have a contract with Kaiser, I see their physicians, because they have a confidential referral program, they don't wanna use their own insurance on their own campus. So there's some of us in the community get paid by Kaiser to see the Kaiser docs and their families. So I'm seeing a heart surgeon and his son, and the next session I'm seeing a psychopath. You need to mix it up, right? There's way too much. Okay, so psychopathy, grief and loss, victims and offenders. I do, like I said, a lot of first responder work, and I train on it. Now I know I was supposed to stop talking, so we can have more questions. Are we doing okay, or do you want me to keep going? Okay. Thanks, Jen. All right, what have I learned? Safety first. What does that mean? Do not put yourself in a position where you're showing off because you can see this guy late at night when no one's in the building. You will be dead. I'm not kidding, right? There will be times, if you're working in a jail or a prison, this is an unsafe place. So I'll give you an example. I had a guy who was 64, old guy, serial killer. He had killed a number of women down in Florida. I'm working in Arapahoe County Jail. They bring him back to Aurora. They extradite him. And what courtesy housed is what it's called. We borrow him for a while. He stays in Arapahoe County Jail because Aurora detectives believe he has killed women in Aurora as well. So while they're interviewing him and investigating him, they want him close by. So they fly him in, of course, it's high profile, so everybody's talking about it. I hear about it. I'm the only psychologist in the jail, so I know I'm going to see him at some point. But I forget about it, okay? So about a week later, I have my wait list. I go down to all the pods and different places to evaluate people. I'm not just evaluating psychopaths. I'm evaluating people for mental illness. Do you need treatment or meds while you're here? That's my job, to come up with a diagnosis. So I go down and tell the deputy, I'm going to be in, I need to see him in the interview room. In the jail, deputies stand by. They're very good at watching over civilians. There's always a deputy with me. In this particular pod, the deputy usually who sits outside the door, stands outside the door, there's a big glass window, and I go into the interview table with the inmate. Most of the time the deputy's sitting right with me. But the way this pod is set up, he's in the maximum security pod, deputies are down there, and they said, okay, Doc, we'll pull him out. He comes down. I do not know this is the serial killer guy by his name. I don't know who he is. So he comes out like this. He's 64. He looks like this frail old man. Does he look dangerous? No. He comes in, he sits down with me, and he said, do you know who I am? And I said, you're Joe Smith, I just asked you. He goes, no, you know why I'm here. And I'm like, oh no, all of a sudden it registered. Oh my God, it's that old guy. And he goes, you're not gonna be able to help me, some old white woman. I'm thinking, I'm as old as you. Some old white woman ain't gonna be able to help me. He goes, you don't know about life. You don't know about growing up in a poor family with lots of kids, do you? And for some reason, I don't know why, I never, very rarely share with people. I went, I grew up in Chicago. Was chased by gang members every day on my way home. I was 9 to 10. We didn't have 2 pennies to rub together. So let's move this along. And he went. And I'm like, ooh. So I do the interview with him, and he's talking about, he said, I want to be in Colorado, they have better food than Florida prisons. Have you ever been there? They're awful. I'm like, no, I haven't been there. While we're meeting, as an inmate or a psychologist. So I'm sitting there, and in the window, there's this well-dressed man. There's no men in jail except men in uniform who are inmates, or deputies in deputies' uniforms, or attorneys, right? So a guy goes by and he stops and he's staring in the window, and the inmate goes, I looked at the inmate, I said, is that your attorney? Because he's staring at us. He goes, no. He goes, I don't know him. So I don't think anything of it. The guy leaves. The guy comes back and looks in the window again. I'm like, this is a little weird. So he leaves. I'm done with the inmate. We're talking, and I said, we're all done. I need you to go back to your cell. There's a deputy outside the door. I think the deputy's outside the door. So he walks up to the table, or out to the door, opens the door. There's no deputy there. I have no idea why. And he goes, there's no deputy here. And I'm like, shit. Okay. I go, well, there is. Now, what do you do in a jail safety first? The inmates walk in front of you. They do not walk behind you ever, 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 right? For some reason, he has the door open, then he shuts the door, he walks back in the middle of the room, and I walk straight out of the room with him behind me. And I open the door and I'm thinking, oh God, why do I have him behind me? So I immediately stepped out of the way, I pulled him out and I pointed at the deputy, I go, he's coming back here, right? I'm like, where were you guys? The guys are great. The problem was it was a rookie deputy who I had not worked with, who didn't know me, wasn't doing his job well. The next day, I find out in a staff meeting with the lieutenants and captains, they called me in, like, oh my God, I'm sorry. I thought on camera they saw him walk behind me. I thought I was in trouble. I'm like, I did something wrong. They're like, we just need to tell you so you don't hear from someone else. Was there a man that walked by the window last night? And I said, yeah. He said, that's the detective from Aurora. And he had called the jail and told the command staff, make sure there are no females alone with that guy, because he has told the detectives, I'm not going back to Florida. And they said, yes, you are. And he says, if I commit a crime in Arapahoe County Jail, I don't go back. And so I'm going to find some fine young woman and kill her. And then you'll see, I'm not going anywhere. So the word did not get to me until after. So I'm like, and you know, you're with all the male captains and chiefs, and I'm like, okay, sir, okay. And I'm like, shit, oh my God, oh my God. He goes, so, he said, we talked to the deputies, because the detective called the next day to the command staff and said, I told your deputies last night, that man is not to be alone with female civilians. What is he doing down there? Should not be doing that, right? And he said, when I walked past the window, there was a blonde doctor in there with that inmate. What was she doing alone? How does he know I'm a doctor? I could have been his attorney. I could be a nurse. How does he know I'm a doctor? Because he went to the deputies and said, who is that blonde woman in the room? And the deputy said, that's our doctor. That same deputy the next day told command staff, that detective never came and talked to me. I didn't know she was there with him. And so command staff are telling me, well, we don't know if we believe the deputy or what happened. And I said, with all due respect, sir, how does that detective know that I'm a doctor? He's like, what? I said, you said he called this morning and said, what's that female doctor doing in that room? And he goes, oh shit. I said, because the deputy told him I'm a doctor. That's how it happened. I'm like, you're the cops, you can figure this out? So, he was escorted out of the building and unemployed about 2 hours later. Yeah, so pay attention. Bad shit's happening. You have scary people. Balance your life. Oh my God, just don't hang out with mental health people. You will lose your mind. Humor and a thick skin. What kind of jokes do cops tell? Very crass, very politically incorrect jokes. You have to have a thick skin. If you are a female and you're working in a male-dominated place, even though it's 2019, do they see you as the same? No, you have to earn your stripes. They still do. Like I mentioned, they call me a nurse. I was hospitalizing someone from my private practice about 6 months ago, and I called dispatch. I said, she's suicidal, she won't contract for safety, I have to send her out. Please send a CIT officer, because those are the officers trained in mental health. And the dispatch said, how do you know what CIT is? And I said, I'm a trainer. And in like 30 seconds, you hear like 700 sirens, so everyone's coming to my office. 2 paramedics come in, they flip up their little laptops with a little stand-up thing. Everyone's around the patient, they're talking, and one of the paramedics turns to the other one and goes, who called this in? And he goes, I don't know, some doctor. So the paramedic, kid you not, male paramedic, turns and looks at me and goes, isn't there supposed to be a doctor here? Isn't that insane? Okay, if you don't have the thick skin and your ego's too fragile, don't do this work, right? I think it's funny. I mean, it's like, oh my God, what year is this? And then he goes, and I went, and the other paramedic's like, oh God, I'm glad it wasn't me. I said, let's go out in the hallway. So I go out in the hallway, he goes, I'm really sorry, doctor. I expected, I said, a man, clearly. Yeah, I'm the secretary, he's golfing, it's Wednesday, one thing goes to another thing. So, have a thick skin, but honestly, the cops are my absolute favorite, the deputies, if you get in on their side, they will love you and do anything for you. I love working with law enforcement, love it, love it, love it. Being human matters, we're all crazy. Everyone in this room is crazy, make no mistake, if you think otherwise, you're in the wrong field. You are. People will not remember how smart you are in family therapy and cognitive therapy and EMDR. What they will know is, do you care about me and does it matter? So when I terminate treatment with people, when they're done, and I say, what was really helpful when you worked with me, what was not so helpful, guaranteed 98% of the time, the helpful thing will be something about when I was human, especially kids. Remember that time you got a speeding ticket right before a session, you were so mad? Oh, that was so cool. Okay, that was their cool thing, right? If you want to be human. Own your own power. Charge a lot of money. If you're good, you can. Do not blink, do not sneeze, do not say, oh, maybe I don't know. You earned the money, you worked really hard. Gift of respect. Last thing I'll say, otherwise I will stop. If you work with people like James Holmes, like I had to, or a theater shooter, how do you get your head wrapped around spending time with him? You're going to see, if you want to see psychopaths, it's all interesting, but it will make your skin crawl and give you nightmares if you're not paying attention, right? So this is what I do for myself. You find the way you do it. I'm, as a mom, Jenny's mom, I think if Jenny was in a jail in New Hampshire, how would I want her treated? Okay. Don't go there. Don't go with mono, they'll segregate you. So, hey, you know what, James Holmes has parents. He has a mama. This is his home, right? Doesn't help you're watching Channel 9 News and they're showing the victims, and that little Veronica Asher could have been Jen's twin eating that ice cream cone. It's on every night when I go home after I'm seeing James. I do not want to see that, right? You have to get your belly in the right place, okay? You will see people that do things to children, you will, right? So, you have to find a way to wrap your head around it or it will eat you alive. Most of the people I went to graduate school with are no longer in the field. And they weren't about 10 years after. I had a good friend became a flight attendant. Many of them become realtors. I don't know why. Or something. You do not want all this school loan debt. Go out to internships, practice, spend time, hear awful stories, and not just on TV that are done in 30 minutes, because those are, very nice. But you will, I tell people, if you followed me for a week on my job, you'd never leave the house. If you're seeing people like that and you know what evil is out there, it's pretty creepy. But I absolutely love it. I would do this job for free, no question. Absolutely love it. All right, Jen, flip through. Are we dying to run out the door? Always talking. There's a class, you want to check? Is that somebody pounding on the door? All right, raise your hand if you think you're a good writer. Raise your hand if you're not a good writer. Okay, if you're not a good writer, become one quickly. Go tutoring. Forensic psychology is a lot about writing. There are attorneys in town who know me just from my reports. You will get work because you write well. If you cannot write well, it's bad. Are they coming, Carla?
Yeah.
Okay.
I was afraid to go out there by myself, though. I had
Okay,
to.
and we'll talk some more if you want to. I'm okay to do that if anybody has to leave. You are not being rude if you need to get up and go. Know your place. What does that mean? You're a student, you're not a doctor yet. And when I teach that to DU grad students, they get offended, especially the women. That's so offensive. That means barefoot and pregnant. No, it doesn't. It means being smart. Know where you are. When I was a psychologist in the jail, I told deputies all the time, I am a guest in your facility. This is a custody facility. It is not a mental health facility. Inmates do not have the same privacy. If they want to talk with me about something private, they don't want a deputy there, too bad. Right? Because I'm going home safe to my family. So go above and beyond. I have students that I've taught that I absolutely loved. When we graduated from DU, somebody was scared and sick because it's so much money. Are we going to be able to pay our school loans? And the dean said, for the top 20% in your class, you will always have work and you will be paid extremely well. And And I think that's true. Just be a top 20%, so work harder, right? Personal matters, I mentioned, the rest is window dressing, being kind, especially to cops. Cops expect you to be the doctor, they're the shrink, you're the shrink, they don't know anything, you will never get anything done, ever. Don't forget, whoever you meet here, like Carla, be nice to her. It's a small world. I've had students that were so sassy and disrespectful, and 8 years later, they interview for a job, and I'm part of the group interview. They go, well, this is never gonna happen. You wanna bet? It's gonna happen. It's a small community, people find you. And you know what, if this is not your cup of tea, but you got into it, I have students halfway through their internship at the jail with me going, oh my God, I can't do this, I have nightmares. Excuse yourself and go do something else, it's absolutely fine. This is not for everyone. And sometimes you don't know until you get in and listen. Just curious. I think we're done. Oh. Can you tell I love to chat? Okay. You need to know the diagnosis stuff inside out. When you work with law enforcement, we had 4 guys attempt suicide in 3 days. In one pod, same day room, same railing, same rope. From Friday night to Sunday night, and I get called at home and they said, when you come in Monday, you're gonna have to do a group debrief with the other inmates. They all witnessed it. 2 of those people almost died. They were airways cut off purple. So I go in, next day, command staff's combing down the front of the jail. Doc, what's going on in there? What's going on in that pod? And I'm like, I don't know, sir, I don't work in that pod. I work down in the medical unit. You're the doctor, you need to know what's going on. What's going on in there? I'm like, okay, I said, what do the deputies say? What deputies? Your deputies that work with these people in that pod, what do they say? You're the doctor, you need to know. Okay? So they followed me down and like, we're gonna find out, we're going down with you. I said, okay, come on down. We go down to the pod. As we're walking down to do the group debrief, it's on the radio. All clear for medical, pod 4. I'm like, oh, shit. There's a 5th guy hanging himself while we're going down to do the group debrief. Command staff goes crazy. What's going on in here? Okay. I need to get 10 minutes with a guy and tell you what's going on, and I need to talk in layman's terms. They don't want psychobabble, they don't get it, they don't care, right? So practice, you people, your people that read your reports, will, like I mentioned, will know you. You will have much more media attention as a forensic psychologist. If you don't like to be in front of a camera, this is a tough job, right? So news channels want to interview you. They want to come and do radio stuff. They want, with James Holmes, it was absolutely a media circus. The worst was women sending him money and begging him to be the father of their children. That was way harder than James Holmes. So walking in every day and they're, have you touched him? Oh my God. Oh my God, what is this, like the Rolling Stones or something? So close, yeah. Know how to present cases, take supervision. I called it with my students when I interviewed them to work with me. Are they appropriately deferent? What does that mean? That means you do what you're told, and you work really hard, and you get your learning, which means you're gonna come to me and go, I have no idea what's going on, or I can't say this to anyone, but I was so attracted to that inmate. Who says that? You wanna have a supervisor where you can say that, so find them. And be deferent, know your place, right? Cops don't wanna hear how special you are. They wanna drink with you, they come to my office, they pace around. Are you scared of guns? Are you scared of guns? No, I'm okay. And oftentimes with cops, I sit on the floor in color while they pace around. Seems weird. I have big leather couches, they sit down, I sit down. What does that do? It's power differential. I don't need to be bigger than you. You need to tell your story, right? I do it with adolescents all the time too. So, integrity, honesty, and grit. Strong smile. I think it's it, Jim. Okay, that's it. Here's my information. Are you posted somewhere or something? I have business cards too, so if anybody wants to reach out to me, please do.